Hello students, slowly and surely we are ending NURS 336, that is Occupational and Community Health Services. We are on section 11 and we are focusing on care of the elderly with emphasis on health promotion of the elderly. So today we are looking at health promotion of the elderly. I believe you remember the meaning of health promotion, do you? If not, let me remind you. Health promotion means enabling people to increase control over and to improve their health. That is the meaning of health promotion by the WHO. Health promotion seeks to make people's home, their work environments, safe, stimulating, and enjoyable places. The numbers of elderly people are increasing, dear students, in most societies globally. And this calls for health promotion and preventive services to increase their ability to function as independent members of society, as well as to foster healthy aging. If people are growing older, it is important that we help them to age gracefully. Given that the aging and longevity is associated with problems brought on by diminishing functional capacity and increasing chronic disease and disability, students, it is imperative that nurses should identify the needs of this population, that is the elderly, and address them with interventions that will help improve the health and well-being of older people to enable them contribute to society. Elderly have a lot to contribute to society, so if we keep them healthy or if we help them to age gracefully, they will contribute to our development. For your objectives at the end of this session, you should be able to define health promotion. You should be able to discuss the normal changes in aging. You should also be able to describe the health needs of the elderly and discuss health promotion activities for the elderly. Students, this is your reading list. Do well to contact the chapters and read them for your information on health promotion of the elderly. Between 2015 and 2050, the proportion of the world's population over 60 years will nearly double from 12% to 22%. Is that alarming? But this is what the WHO says will happen. By 2020, the number of people aged 60 years and older will outnumber children younger than 5 years. That is interesting. Also, in 2050, 80% of older people will be living in low and middle income countries. Lamentable, isn't it? The pace of population aging is much faster in the past than in the past. All countries face major challenges. Therefore, to ensure that their health and social systems are ready to make the most of this demographic shift. Dear students, people worldwide are living longer, as I have said earlier. Today, for the first time in history, most people can expect to live into their 60s and beyond. By 2050, the world's population aged 60 years and older is expected to total 2 billion, up from 900 million in 2015. Today, 125 million people are aged over 80 years. And by 2050, there will be almost 120 million living in China alone, and 434 million people in this age group worldwide. Also, by 2050, 80% of all older people will live in middle and high-income countries, as said previously. A longer life brings with it opportunities, not only for older people and their families, but also for societies as a whole. As I said, the elderly contribute tremendously to national development. Older people contribute in many ways to their families and communities, wait a minute and think of all the elderly are contributing in your family as well as in the community. Are they just there as old people to be looked after, or are they contributing to the way homes and communities are being run? This is a food for thought. This is food for thought. Yet the extent of these opportunities and contributions that we obtain from the elderly depends heavily on one factor, that is health. If they are healthy, they are there to contribute. If they are not healthy, they cannot contribute to national development. There is, however, little evidence to suggest that older people today are experiencing their later years in better health than their parents. While rates of severe disability have declined in high-income countries over the past 30 years, there has been no significant change in mild to moderate disability over the same period. If people can experience these extra years of life in good health, and if they live in a supportive environment, their ability to do the things they value will be little different from that of a younger person. If these added years are dominated by declines in physical and mental capacity, the implications for older people and for society are more negative. I hope you follow the argument. There are some outdated and ageist stereotypes. Students, it is often assumed that, or it is often believed that older people are often frail or dependent and a burden on society. Is this true, or this is a fallacy? Public health and society as a whole need to address these and other ageist attitudes which can lead to discrimination. It would be too bad if we discriminate about the elderly in society. And this will affect the way policies are developed and the opportunities older people have to experience healthy aging. All we are calling for these elderly people is healthy aging, or to make sure they age gracefully. There are several measures we can undertake to foster healthy living among the elderly, and these include providing healthy and supporting environments, providing social support networks for the elderly, adequate nutrition and low intake of calories, including alcoholic beverages. We should discourage the elders from drinking alcohol, shouldn't we? We have to do that as nurses, wherever we find ourselves and wherever we find the elderly. We should also ensure they have adequate sleep and adequate hydration. Dehydration can kill the elderly, so we have to ensure they have adequate hydration, as well as regular moderate exercises. It may surprise you that the elderly also need to have exercises to keep healthy. We have to make sure they have access to health services. We have to ensure regular health checkups. We have to ensure they take their drugs. You will find that the elderly are on multiple treatments, and we have to make sure they adhere to their prescribed treatment regimen. We have to help them lead healthy lives. It is important to ensure they lead healthy lives. Maintaining healthy behaviors throughout life, particularly eating a balanced diet, engaging in regular physical activity, and refraining from tobacco use, all contribute to reducing the risk of non-communicable diseases and improving physical and mental capacity or well-being. And this is according to the WHO. The WHO is undertaking a lot of measures to help the elderly grow gracefully. So we are going to look at the WHO's response as far as elderly care is concerned. In accordance with a recent World Health Resolution, A comprehensive global strategy and action plan on aging and health is being developed by WHO and in consultation with member states and other partners. The strategy and action plan draws on the evidence of the World Report on Aging and Health and also builds on existing activities to address 5 priority areas for action. One is commitment to healthy aging, and this requires awareness of the value of healthy aging and sustained commitment and action to formulate evidence-based policies that strengthen the abilities of older persons. So here the WHO ensures that evidence-based policies are formulated in the interest of the elderly. 2. Aligning health system with the needs of older populations. The needs of older populations have to be met, and health systems have to be aligned so that they meet these needs. In this regard, health systems need to be better organized around older people's needs and preferences, designed to enhance older persons' intrinsic capacity and integrated across settings and care providers. The third is developing systems for providing long-term care. The elderly may need long-term care, and WHO has strategies in place for this purpose. The fourth is creating age-friendly environments. This will require actions to combat ageism and enable autonomy and support healthy aging in all policies and at all levels of government. The fifth is improving measurement, monitoring, and understanding, all in the interest of promoting health in the elderly. In summary, aging can be healthy. It is not a sad thing to age. Aging can be healthy, and aging does not mean ill health. The elderly are not frail. They are not always frail, as some people tend to think. They don't always depend on people, and they are not a burden on society, as frequently portrayed. They are a resource to their societies, and their needs are worth addressing. Healthy aging is encouraged. Families, societies, and the healthcare system must work collaboratively to achieve a healthy elderly population. Thank you, students, for your attention.